Next presenter is Dr. Priyanka Gund. Our topic is Essentiality of Universal Neonatal Eye Screening, and the chief author is Dr. Smita Singh.
Good afternoon, everyone. Myself, Dr. Priyanka Gund, as a junior resident from the MGMS Sevagram. I'm here to present essentiality of the universal neonatal eye screening. The question is, universal eye screening, why? Neonates are not able to express themselves for any ocular disorders as that of adult. Newborn eye screening at birth has greater impact in reducing the long-term visual impairment because of the early identification of the ocular abnormalities. Universal eye screening approach can be useful for early detection of ocular mobilities, neonates in which early clinical intervention for diseases which require the treatment can influence and improve the visual clinical outcomes. Aim and objective is to find the ocular abnormalities in a neonate using universal eye screening, also to estimate the incidence of any ocular morbidities in a neonates. It is a prospective observational study in which the inborn neonates in the postnatal care ward and neonatal intensive care unit was in a tertiary care hospital was screened for any ocular morbidities during a period of 6 months. These are some pictures while taken from during screening. Informed consent was taken from the parent or the guardians. These are some consent forms. Demographic details like history, unique ID, gestational age, chronological age, sex, birth weight, current weight, and date of birth. Also, mode of delivery was noted and collected in a pre-designed performer, which was seen there. Torchlight examination of anterior segment was done for any ocular structural abnormality like eyelid coloboma, congenital ptosis, eyelid entropion, capillary hemangioma, etc. Also, corneal opacities, congenital cataract, congenital glaucoma, and the other globe abnormalities like anophthalmos, ophthalmos was diagnosed. These are some clinical pictures we are getting from during torchlight examination during the screening. As a result, we screened during a period of 6 months 2410 neonates for any ocular abnormality, out of which 52.61 were males and 48.38 were females. 53.23 was born by normal vaginal delivery and 46.76% were born by lower segment sections. We found that the incidence of congenital dacryocystitis was maximum, that is 19%, followed by the fundus abnormality, which is 11.11%, ophthalmic neonatum 2.44%, and the facial abnormality was found to be 0.12%. Using RBSK guideline, that is the Rashtriya Bal Swasthya Saryakram guideline, most commonly detected abnormality during the screening was congenital dacryocystitis. Facial abnormalities like anophthalmos, facial palsy, congenital ptosis, cleft lip, and cleft palate was also found. Anter-segment findings like subconjunctival hemorrhage, conjunctival congestion, conjunctivitis, ectropion UVA, ophthalmic neonatum, etc. was also found. Most common fundus abnormality which is found during the screening was ROP, followed by the retinal hemorrhage. Management. Ocular conditions like congenital dacryocystitis was treated initially by teaching the mother or the grandmother to give the gradient massage to teach them how to take a lead hygiene and prescribing the local antibiotics. Anter-segment abnormality was treated appropriately by local application of the antibiotics. Facial abnormality was diagnosed earlier and planned to be a suitable approach in consultation with the pediatrician or a surgeon. Most commonly, fundus abnormality was ROP, and those who requiring a laser or intravitreal treatment was given to prevent the blindness. Screening in the early newborn period is important because the prognosis for the same condition depends on the early detection and early treatment. Screening prevents the developmental delay in a neonate during infancy and promote the neonatal health, as it identifies any factor which block the pupillary pathway resulting in the abnormal red reflex. It concludes that red reflex is a test which is easy, simple to perform, and non-invasive, requires minimal equipment, and can detect the many ocular abnormalities. Early detection by torchlight examination may help in preventing the ocular morbidity and will decrease the blindness in a neonate, leading to decrease in the childhood blindness. Hence, the neonatal eye screening is essential for every birth of the neonate. These are some references which I used. Thank you.
Yeah, Dr. Smita, well presented. The only problem I find is population in developing countries in India. So if we start doing neonatal screening, then maybe the load on ophthalmologists will be even more, and I don't know whether it will be practically feasible or not. But well presented anyways. What was the population? What was the sample which you took for this?
It is during a period of 6 months, we have screened 2410 neonates, which is inborn neonates in a tertiary care hospital of ours.
Okay, that is your hospital. you
Yeah,
have
my,
done.
my hospital.
Okay. Any questions from my co-judges?
Any separate group for screening of ROP in your study?
Yes, sir, there is a ROP guideline under RBSK.
It was a hospital-based study.
Yes, yes, ma'am.
So how would you extrapolate it to the community?
We screen the inborn neonates, and we would like to, we tell them that promote the other peoples to come over if there is any problem in the neonate, like any congenital problems, they will consult us in our department.
So did you have any association with the pediatricians?
Yes, yes, ma'am. In the every Friday, we used to go on a on a daily basis. We used to go for 1 hour in the postnatal care ward and also in the neonatal ICU for the screening of the neonates.